there's too many, which is amazing how quickly this field has happened. There's actually too many different trials of combinations and responses to go through each and every one of them in detail. But highlighting here just to give you a sense of some of these studies that are ongoing in combination with azacitidine and venetoclax. We have all four of the initial menin inhibitors, revumenib, bleximenib, ziftomenib, and enzomenib in combination with azacitidine and venetoclax for patients with relapsed refractory AML, all of them allowing both NPM1 and KMT2A rearrangements. You'll notice that the SAVE trial in the beginning also allows NUP98 rearrangements. And preliminary efficacy is shown on the right in fairly small numbers, but I think, you know, fairly compelling responses and improvements in durability. So that was relapse refractory combinations. And so now we'll move into thinking about some of the combinations for newly diagnosed AML patients. And so there are quite a few studies here to talk about as well. There are two revumenib frontline studies with aza-ven. There's the BEAT AML study, which is a multi-center US study, and then the SAVE trial, which is ongoing at MD Anderson. Two ziftomenib studies, one with 7 and 3, one with ven-aza. These are the COMET studies. It's actually the same COMET 007, but with arms for intensive chemo and ven-aza appropriate patients. And then bleximenib with 7 and 3. The preliminary activity in, you know, all of these are shown on the right. And I mean, we're getting to response rates of 90% and higher, composite remission rates, you know, mid 80% or so on average. So I think really compelling in terms of initial response rates for sure in these frontline treatment populations.